Pleural effusion is an accumulation of excess amount of fluid between the pleural layer. Normally between the pleural layer there is little or no fluid, but sometimes there is an accumulation of excess fluid between the layer. It is called as a pleural effusion. As a result of the pleural effusion, the patient will feel difficulty in lung expansion during inspiration. The pleural effusion is classified into two types, transudative effusion and the exudative effusion. The transudative effusion is produced due to alteration of systemic factors that affect the formation and absorption of a pleural fluid, such as increased capillary hydrostatic pressure or the decreased plasma oncotic pressure. As a result of these two factors, there will be increased pleural effusion, and this pleural effusion is called as a transudative effusion. The transudative effusion is usually bilateral and there is a decreased protein content. The cause which lead to transudative effusion include superior vena cava syndrome, peritoneal dialysis, pulmonary embolism, congestive heart failure, cirrhosis and nephrotic syndrome. Among all of these causes, the congestive heart failure is most common cause of transudative effusion. About more than 90% of cases of transudative effusion is due to congestive heart failure. Now come toward the exudative effusion. And the exudative effusion is produced due to either increased capillary permeability or the lymphatic obstruction. As a result of these two defective mechanisms, there will be accumulation of excess fluid between the pleural layer. The exudative effusion can be bilateral or unilateral and there is an increased protein content. And the causes which lead to exudative effusion include parapneumonic effusion, mean effusion associated with bacterial pneumonia, lung abscess, infection such as viral, bacterial or fungal, cancer, trauma or tumor, uremia, rickettsial infection, esophageal perforation, Meeks syndrome, asbestosis and pancreatic disease. The Meeks syndrome is a benign condition associated with ovarian tumor, hydrothorax and ascites. There are a wide variety of causes of exudative effusion. To remember it, we use a mnemonic picture map. Each letter represents one cause of exudative effusion. By now, we are done with pleural effusion and the causes and the classification of a pleural effusion. Now a question arises that how we will differentiate the pleural effusion clinically. Distinguish transudative effusion from the exudative effusion clinically, we use Light's criteria. Mean the Light's criteria is specifically used to know the cause of pleural effusion. The Light's criteria consists of three parameters: the pleural fluid protein to serum protein ratio, pleural fluid LDH to the serum LDH ratio, and the pleural LDH. In the transudative effusion, everything will be decreased. Mean the pleural fluid protein to serum protein ratio will be less than 0.5. The pleural fluid LDH to serum LDH will be less than 0.6 and the pleural LDH will be less than 2/3 of the upper limit of normal serum LDH. While in exudative effusion, as the word E represent, everything will be in excess, such as there will be the pleural fluid protein ratio to the serum protein will be greater than 0.5. The pleural fluid LDH to the serum LDH ratio will be greater than 0.6 and the pleural LDH will be greater than 2/3 of the upper limit of normal serum LDH. So in short, in transudative, everything will be decreased, while in exudative, all the three parameters will be increased, mean will be in excess. So it was all about the Light's criteria, but there is a one important note regarding the Light criteria which is very important to understand. For transudative effusion, all the three parameters should be fulfilled. Mean a patient should have all the three criteria for a transudative effusion, while for the exudative effusion, only one criteria is enough. For example, if a patient present with pleural fluid LDH to serum LDH less than 0.6 and the pleural LDH less than 2.3, but the pleural fluid protein to serum protein ratio is greater than 0.5. So there are two criteria are fulfilled for transudative, but one is for the exudative. In such case, we consider that the patient is having an exudative effusion, because for the exudative effusion, according to Light's criteria, only one criteria should be met. So it was all about the pleural effusion, its causes and the lights criteria. If there is still any question, you guys can ask and stay tuned for more update.